Hi, my name is Ray Basri and I'm a physician and firefighter in New York. I'd like to talk today about returning employees safely to the workplace. This is a topic that's extremely important for us because what we want to do is return society to normal, get everybody working, and have a lot of normalcy back in our lives. So in order to do this, I'd like to talk about a strategy that is effective and easy to perform. So we need 2 tests to be completed in order to return people to the workplace. The first is we need an antibody test. So this can be done on site with a finger stick. It's a capillary draw. It's a drop of blood that is analyzed within 10 minutes. That test will give an antibody response. There are 2 antibodies that comprise that test. There's an IgM, immediate response antibody, and there's an IgG, which is more of a natural immunity the body develops after being exposed to the COVID virus. So the first IgM peaks within a couple of days, and then the IgG should also be present, and that forms in larger quantities over the next several days. That will give us an immune response, protective response that will last probably at least a year for the COVID virus. So if you have IgG antibodies, effectively you know that you've been exposed, you've gone through the illness, and you can progress then to returning to work if you have the second test done. The second test is a nasopharyngeal swab. That swab is done to look for shedding of virus from the respiratory tract. If you are testing negative for the shedding of virus and you have an IgG immune antibody in your system, you should be effectively able to return to work without any respiratory protection, without any additional precautions, because it shows that you have already gone through the illness. You may have had little or no symptoms. Some of the symptoms of the COVID infection may have been an upper respiratory infection, cough, mucus, runny nose, sore throat. Some people also have gastrointestinal symptoms. They have an upset stomach, they have nausea, vomiting, diarrhea, but this passes pretty quickly. Most people with the COVID infection, 90% will have a fever. So a fever of 101 would be indicative of somebody that had a reasonable chance of having a COVID infection with the other symptoms I mentioned. So if we want to return people to the workplace, you get the on-site IgG, IgM test. IgG needs to be positive, and you get the nasopharyngeal swab, shows you're no longer shedding the virus, and then you can take off your respiratory protection, safely return to the workplace. I'd like to thank you for looking at this video today. I'd like you to subscribe to our channel on YouTube, and I hope that you can give me back some favorable comments as you did with my first video on protecting oneself from the virus. Thanks so much, Ray Basri.